And I had some questions for them. First, I'm going to ask Trevor, what kinds of things can you and the other medical providers here do?
Physicals, preventative medicine, and we handle a wide range of disease management to include minor emergencies.
And do we still take new patients?
We do still take new patients.
Tell me a little bit about integrated behavioral health and how does that work?
It involves a cognitive behavioral therapist who works closely with us to manage different types of mood disorders. We talk back and forth about any changes that may occur with the patient, and we're able to make changes right then and there.
And how about the behavioral health consultant working with things like lifestyle management?
All types of lifestyle management to include exercise, dietary modifications, and weight loss modifications that help with the disease process such as diabetes and cardiovascular disease.
What's a warm handoff? That's a term we use a fair amount.
When a patient is new to our behavioral consultant or in a crisis, we can go get the behavioral therapist and do a brief intervention.
So the behavioral health consultant actually comes right into the room and the three of you, the patient and you, all together discuss their case?
Correct. We're able to integrate the two and we keep each other informed on how the patient's doing and progressing.
What sorts of leading edge medicine do we practice here?
We integrate dental with medical. We also have telemedicine, which allows us to get access to specialists through UC Davis and get referrals that would otherwise be difficult for our patients in this remote area. We also have personal digital assistants, which allows us access to medical information.
And so having a PDA or personal digital assistant like that, you just take that right into the room with you, and that way you have all your resources right with you when you talk to the patient.
Yes, yes.
Okay, Judy, for you, do you find that when patients are seen here, does it make a big difference if they have Medi-Cal or Medicare, if they have insurance or they're cash paying?
Well, for the most part, when I see a patient, I usually am not actually aware of what their insurance is. So from the standpoint of how I would manage the patient, I wouldn't really be aware of their insurance status really until I got to the care plan, and that's where it becomes important. Obviously, with the different healthcare programs we have now, there are certain restrictions that we can have, but for the most part with Medi-Cal, it's actually almost easier. The hardest patient probably is the non-insured patient, but we do have programs available through the clinic where people do pay at a reduced rate according to what their income is.
Right, a sliding scale.
A sliding scale, so we're able to provide their service, and we do find that out when we're developing our care plan.
So pretty much if you were a Medi-Cal patient or a cash-paying patient, you basically get the same quality of service as you would as someone with the best insurance in the world.
Absolutely.
Great. What happens if somebody needs to see a specialist?
Well, in our community, we do have, actually in Grass Valley, Nevada City area, we do have quite a few specialists. If it's an insurance patient, an HMO, PPO, then we often are able to make the referral at that time. If it's a Medi-Cal or Medicare patient, sometimes we can take care of that within our community. Very often, though, we do have to refer down to UC Davis or UC San Francisco.
And some of the time we can use telemedicine too.
Yes,
so that gives us one more option. What about things like blood work testing and electrocardiograms? What about those sorts of things?
Well, we can do the EKGs here, and we do have cardiologists available in the community, so if there is a problem, we can access them rapidly via the fax machine. We do fasting lab and labs if they need to be done at that time, and we also do have X-ray available to us, and we are for the most part able to get the care plan going, within the clinic walls.
Great. So as much as possible, we try to make it one stop.
Exactly, one stop.
Well, here we are with two of our medical assistants. They're part of our clinical staff that assist our medical providers in caring for patients. We'll be talking with Vicki Burkhart and with Patricia Hall. Vicki, I have some questions for you first. The first one is, how do you find being a nurse here different than in some of the other places that you've worked?
Well, the last place that I worked was in pediatrics, and I saw quite a few children all day long, and I gave vaccines. I really enjoyed it, the children, but I find this experience here at Sierra Family Medical Clinic very enjoyable. I have met so many wonderful people, and the patients also seem to enjoy me, and it makes me feel like I'm amongst a family within a small community. I definitely feel like I'm making a difference in their lives. They've commented that I smile all the time, and they like that. Patients like to be smiled at, and they tend to smile back. So it makes them have a warm, cozy, wonderful feeling.
If someone's been seen for a visit here, and then when they get home they realize they had a question they didn't get answered, or they realize they're not quite sure how to take their medication, how would they handle that?
They can call it anytime during office hours. It gets plugged into our a message machine, and we answer it as soon as we can before lunch or before we go home in the evening. And if the provider at that time isn't available, we call the patient and let them know we're working on it, so they know somebody's doing something for them at the time.
How about just a general medical question? Somebody has curiosity about whether they're really due for a tetanus shot, or wants to know about Lyme disease and should they be worried about it. Is that something they could call about?
They can definitely call about that, and that's usually something one of us nurses can handle, one of us medical assistants can handle. A tetanus, we just pull their chart and we look in the chart and see when they've had their last one and give them the information. It happens pretty quickly.
For you, Patricia, how do you work to create a family feeling for the patients here?
Probably in no place are they quite as vulnerable as they are around their health issues or health issues of their loved ones. So we try to do whatever we can to make them feel comfortable. It's also a very close-knit community up here, so working at the clinic and seeing these people is just a natural extension of the relationships that we have outside the community. Maybe our children go to school with their children, or we see them at the market. And so it's very easy to ask about the things that are important to them. We treat people how we would like to be treated. And it's really uppermost in our minds as we're relating to the patients on a day-to-day basis.
And what do you screen people for while you're getting them ready for their visit with the provider? You know, you're taking their blood pressure, things like that. What are you actually looking for?
The first thing we do is check their vitals, their blood pressure, their temperature, respiration, pulse, their weight and height. But we're also, as we're talking to them informally, just doing an assessment. Number one, why are they here for the visit today? Do we have everything we need to make an efficient and productive visit? But also, we're assessing their emotional state of mind. We're looking for signs of anything that might have changed in their physical health. Are they coughing, or do they look depressed? And just in the conversation, the informal conversation we have with them, we're able to relay that information to the provider, so he can have a much more productive, helpful visit to the patient.
Good answer.
This is a CME presentation that will be provided by Dr. Jim Bourgeois at UC Davis Medical Center. Some logistics. My name is Speranza Abram. I'm the Executive Director of Northern Sierra. Dr. Van Houten?
Yes, this is our telemedicine suite here, and we're actually going to be watching a brief portion of a presentation that's being done for our medical staff as part of our ongoing clinical education to improve our integrated behavioral health services. Our presenter today is Dr. Bourgeois, a psychiatrist at UC Davis, and this is the second in a class series on emergency psychiatry. Dr. Bourgeois?
Thank you, Peter. And where we'll pick up the talk is on the topic of psychotic illness. Okay?
Yes, we're ready to go. Thank you.
All right. Regarding the presentation of psychotic illness, despite popular belief and much mythology, in fact, most psychiatric patients are not violent. It is true, however, that violence is more common in psychotic patients than in normals. So the truth is really rather in between.